افتكر هذا. طيب افتكر احنا اخر مرة وقفنا في نيكولاي ده، لو ما غلطان.
الطاقية ولا التحدث؟
الطاقية، احنا ما عملنا توماس جرين ده.
اوكي، تمام.
طيب، منو المتبرع هسه حيكون؟ who's next؟ ضمن
أعتقد
النقطة
لينا.
دي.
لا. السلام عليكم.
وعليكم السلام ورحمة الله.
السلام ورحمة الله وبركاته.
لينا بابكر معك يا بس.
تمام، لينا انت وين؟
في
أنا
قطر.
في الدوحة.
اوكي، يعني المفروض شبكتك كويسة.
أنا
ايوه
كويس إن
اكيد.
شاء الله.
تمام جدا. اوكي.
مرحبا بك يا دينا، تفضلي.
أهلا يا بس.
طيب حاليا احنا نفتكر في الفترة اللي فاتت كلها كانت عبارة عن long cases اللي هي من 15 to 20 minutes has been averaging at 20 minutes. ودايما بتكون يعني زي full assessment with a particular focus هنا. يعني دي في الفترة اللي فاتت، هو دي أحسن أفتكر لأنها بتدي زمن كفاية للهناية full assessment. فأنا ابتدي أفتكر في توماس جرين: You are on call psychiatric trainee, and the receptionist at the emergency department has informed you that a man has arrived unannounced, insisting on meeting the doctor who treated him a month ago. Mr. Thomas Green has come to the emergency department today, convinced that the doctor who treated him a month ago is in love with him. His belief is based on as the special attention he received during the last visit and the way the doctor looked at him. He is adamant about seeing her today to discuss their future together. Your task is to engage with the patient to perform mental state examination and conduct a risk assessment. It's going to be I think it's going to be a full evaluation. طيب هو
تمام.
بس ادانا الفكرة انه this is erotomania case study. Erotomania is a rare disorder characterized by the delusional belief that another person, often of higher social status, is in love with the individual. This condition falls under category of delusional disorder in the ICD-11, International Classification of Disease 11 revision. The key features of erotomania is the persistent belief in unrequited love, which the patient maintains despite clear evidence to the contrary. ICD-11 and NICE guidelines. Erotomania classified under 6D90 delusional disorder in the ICD-11. It is essential to differentiate erotomania from other conditions such as schizophrenia, bipolar disorder, and obsessive compulsive disorder, where delusions of love might occur but are not the central feature. NICE guideline: while the National Institute of Mental Health and Care Excellence provides comprehensive guidelines on managing various psychiatric conditions, specific guidelines for erotomania are integrated within the broader context of managing delusional disorders. Key recommendations include: assessment and diagnosis should be thorough, considering the individual's history and current presentation. Treatment options may include antipsychotic medications and psychotherapy, focusing on cognitive behavioral approaches. Importance of a multidisciplinary approach, including psychiatrists, psychologists, and possibly social worker, to address the complex needs of the patient. Communication skills وهنا الكلام المهم. Communicating with the patient with erotomania requires sensitivity, empathy, and clear boundary setting. Here are some tips. Empathetic listening: show an understanding for the patient's feeling without reinforcing the delusion. Clear boundaries. Example of انك انت you show understanding without reinforcing the delusion. انت ممكن تقول يعني it sounds like انت you care a lot about this patient. انت ما انا agree with you انك you're in love وان الموضوع ده valid. You just reflect on it without necessarily agreeing with it. Clear boundaries: establish professional boundaries firmly but kindly. It is crucial to convey that the relationship is strictly professional. Reality orientation: gently challenge delusional beliefs by focusing on reality-based conversations. However, avoid confrontational dispute of the delusions. Safety and support: ensure that the patient feels safe and supported. Discussing their support system and involving them in care plan can be beneficial. Suggested questions. Understanding the delusion. Can you tell me more about your feelings and why you believe the doctor is in love with you? How long have you felt this way? And what specific incidents make you believe in this love? Assessing insight and impact. How does this belief affect your daily life and relationships? Are you aware of how others perceive your belief about the doctor's feeling toward you? Exploring background and mental state. Have you ever experienced feelings or beliefs like this about someone else before? How have you been feeling overall lately in terms of mood, sleep, and appetite? Safety and support. Do you have support system or someone you trust that you talk about your feeling? Have you thought about what you might do if things do not turn out the way you hope with the doctor? Treatment willingness. How do you feel about getting some help to feel better and possibly see things more clearly? Are you open to discussing treatment options that might help you manage these feelings? Approaching risk assessment with erotomania. In addition to understanding the patient's belief and offering support, a critical aspect of managing a case of erotomania involves conducting a thorough risk assessment. This ensures the safety of all parties involved, including the patient, the healthcare provider, and others who may be indirectly affected by the patient's delusional belief. Here are some suggested questions to include in your risk assessment. Assessment of risk to self. Have you had any thoughts of harming yourself because of these feelings? Do you have any plans or intentions to harm yourself if things don't work out as you hope? Assessment of risk to others. Have you thought about how you would react if the doctor does not reciprocate your feelings? Have you ever thought about harming the doctor or anyone close to you because of the current situation? Understanding the social and behavioral boundaries. What actions have you taken or plan to take in relationship with your feelings toward the doctor? Have you ever tried contacting or seeking out the doctors outside professional settings? History of risky or aggressive behavior. Have you ever acted on your feelings in a way that you or someone else got hurt? Do you have a history of confrontation or legal issues related to similar situations in the past? Access to means. Do you have access to any means that could be used to harm yourself or others? Have you collected any items or made any plans that could be used in a way to threaten or harm anyone? Substance use. Do you use alcohol or drugs? If yes, how does it affect your feelings or actions toward the situation? Have you noticed an increase in substance use since these feelings began? Support system. Who can you turn to when you are feeling overwhelmed by these emotions? What coping strategies have you used in the past when dealing with difficult emotions? خلاص نفتكر that's the relevant part هنا. طيب دينا جاهزة؟
إن شاء الله.
يلا تفضلي.
اسمه منو؟
Thomas Green.
Hi, not sure who you are. Is she here? I'm here to see Dr. Stone. Could you go and get her for me?
Hello, Thomas. This is Dr. Lina. I'm the psychiatry trainee in Co, and I'll be helping you today.
Oh, right, Dr. Rena. Well, I really just need to speak with Dr. Stone, if that's all right. She'll understand. We've got something important we need to talk about. I know she's probably busy, but if you could just let her know I'm here, I'd appreciate it.
All right. I just want to have a short conversation with you, and then we will see how to assist you. Could you please tell me what brings you here today?
I just really need to see her, that's all. It's important. Ever since the accident, we've had this connection, you know? I know she feels it too. I can't stop thinking about her. It's like everything just makes sense when I picture us together. I just want to see her, talk to her, make sure she's all right, and that she knows how I feel.
Okay, so I see. Could you please tell me more about the feelings that you have been experienced lately?
It's been a lot. Honestly, I feel restless most of the time, like I'm just waiting for something to happen between us. I get this rush whenever I think about her, like excitement mixed with nerves. But then when I'm not thinking about her, I just feel empty, like, nothing else matters much. It's hard to focus on anything else. And I just keep replaying what happened in the hospital over and over in my head. I know it sounds a bit much, but it feels real to me.
Okay, I see. Did you have any contact with her lately, or it just that visit?
No, I haven't seen her since that day at the hospital, but honestly, the way she spoke to me, the way she looked at me, I know she wanted to say more. I haven't called her anything. I keep thinking she'll reach out, or maybe I'll run into her again. Sometimes I check the
Mm-hmm.
hospital's website, but I haven't found a way to contact her directly yet. I just have this feeling she's waiting too.
Mm-hmm. I see. Um, may I please know uh, why you believe that she is in love with you? If any
It's
particular
hard to explain.
incident happened at that visit?
Well, nothing dramatic happened, if that's what you mean. It was just the way she treated me. She was so gentle, so caring, more than just a regular doctor. She listened to me, really listened. She smiled at me, touched my hand when she was checking my injuries, and there was just this feeling in the room. I could tell it wasn't only about the medical stuff. It was like we understood each other without even saying much. I know it sounds strange, but I just felt it.
I believe that she would give the same attention for all of her patients. Um, could you please tell me for how long you have been feeling this way?
I know what you're saying, but it wasn't just normal attention. It was different with me. I could see it in her
Mm,
eyes. This feeling's been going on since the accident, so about a month now, it just hasn't gone away. If anything, it's only gotten stronger. I can't shake it, no matter what I do.
mm-hmm. I see. Any specific or special things for you, Thomas, from her side?
Yeah, it was the way she spoke to me, soft, almost like she cared about me personally. She remembered little details I mentioned, and she smiled at me, not just because she had to. When she touched my arm, it lingered a bit longer than usual, I think. She told me to take care of myself and looked at me in this way that just felt meaningful. It's hard to put into words, but I know what I felt.
I believe this is the care that we would give to any of our patients. Um, I'm interested to know how does this belief affect your daily life or any impact on your daily life?
It's honestly been taking up most of my thoughts. I find it hard
Mhm.
to concentrate on my work, like I'll start a project and then just drift off thinking about her or planning what I'll say when I see her again. I've sort of pulled away from other people too because they don't really understand. It's like nothing else feels as important right now. Sometimes I stay up late just imagining our future together. So, yeah, it's definitely changed how I go about my days.
I see. So, you think that the other are noticing what you are doing or what you are feeling?
I don't think most people really notice, to be honest. I don't talk about it much with anyone else. I mean, my mum still calls from Australia sometimes, but I just tell her I'm busy with work. And my mates here,
Hmm.
I haven't really seen them lately, so I doubt anyone really knows what I'm feeling or thinking. It's all just been between me and, well, my thoughts about Dr. Stone.
Hmm. I see. I see. Um, could you please tell me if you have these feelings toward any of your caregiver before, or it's just this time?
No, never like this before. I've had doctors and nurses look after me in the past, but it was always just, normal. This is the first time it's ever felt like this. So intense, so real. It's only been with Dr. Stone. There's just something about her that's different.
No other colleagues, friends?
No, not really. I mean, I've had friends and I've liked people before, but nothing ever felt this strong or meaningful. It's like with Dr. Stone, everything just clicked. I can't explain it. Other people just don't compare. I don't really feel close to anyone else these days.
Hmm. I see. Um, Does this affect you, like your mood, your sleep, appetite?
Yeah, it does. My mood goes up and down a lot depending on what I'm thinking about her. Sometimes I feel really happy, like hopeful, but other times I get anxious or restless, especially at night. I haven't been sleeping that well, keep staying up late, just thinking. My appetite's not great either. I skip meals sometimes without even realizing. It's just hard to focus on anything else.
I see. Um, any challenge with sleep?
Yeah, definitely. I have trouble falling asleep most nights. My mind just keeps racing with thoughts about her, what she might be doing if she's thinking about me too, what our next meeting will be like. Sometimes I barely get a few hours, and even then I wake up thinking about her again. It's exhausting, but I can't stop it.
That must be hard. Um, you told me about your mother and she live in Australia, right?
Yeah, that's right. She still lives in Sydney. We talk on the phone every so often, but it's not the same
Mm-hmm.
as being there, you know? I haven't really told her much about what's going on. Don't want her to worry. She just thinks I'm busy with work and settling into life here.
Do you have anyone close to you beside your mother you can talk and share your feelings with?
Not really. Since I moved here, I haven't made many close friends. There's a few people I know from work, but it's all pretty casual. I don't really feel comfortable sharing this sort of thing with them. Most days, it's just me on my own. So, no, I don't have anyone I talk to about how I'm feeling.
I see. Did you ever thought about what if this doctor, like the things don't turn out the way you want it to be?
I try not to think about that, honestly. It just doesn't feel possible. I know it might sound strange, but I feel so sure about what's between us. If things didn't work out, I don't know what I'd do. It's like everything else would fall apart. I don't want to imagine that. I just want to believe in what I feel because it's all I've got right now.
Mm-hmm. So do you think that this may um exacerbate thoughts of harming yourself?
I don't really want to hurt myself. I just feel lost sometimes, like nothing else matters if this doesn't work out. It gets really heavy, like there's no point to anything else. But I haven't done anything to hurt myself. I don't know what I'd do if I lost this feeling or if she really didn't feel the same. It scares me to think about.
Mm-hmm. And if she don't and didn't feel the same, do you believe that you might harm her?
I don't want to say that I would, but honestly, I just don't know. The thought of her not feeling the same makes me feel empty and desperate. It's hard to imagine moving on from that. I haven't made any plans to hurt myself, but I can't say for sure how I'd cope if it all fell apart. It's just really hard to think about.
Mm-hmm. I see. And do you believe that she have the right not to feel the way you want her to feel?
I mean, I get that people have their own feelings, I do. But with her, it just doesn't feel possible that she wouldn't feel the same. Everything about the way she acted, it all seemed so real to me. I know it sounds a bit off, but I can't help it. It's like my mind just won't let me believe she doesn't care. I try to tell myself she has her own life, but I always end up thinking we're meant to be together.
Mm-hmm. I see. Do you believe that you might need help in this regard?
I don't know. Maybe. I mean, I just want to see her and talk to her. I think that would make everything clearer, but sometimes I do feel like I'm stuck. Like my head won't let me think about anything else. It's exhausting. Maybe I do need someone to talk to, but it's hard to imagine anyone really understanding how real this all feels to me.
Mm-hmm. Would you be open to receive your health care from other provider than her?
I guess I could. It's just I feel like no one else would really get it the way she does. But if it's just about talking or getting help with how I'm feeling, I suppose I could try. I just don't want to lose the chance to see her again. That's the hardest part for me.
Hmm. I see. We would do our best to help you. with this matter.
All right, thank you. I just want to feel a bit better, I suppose. If you can help with that, I appreciate it. I just really hope I can see her again one day.
Okay. Would you please tell me what means or tools that you used before to reach out to her?
Mostly, I've just checked the hospital's website to see if there's any way to contact her, but I haven't found much. I thought about calling the hospital, but I didn't want to seem weird. Sometimes I walk by the hospital hoping I might see her coming or going, but I haven't run into her yet. I haven't done anything else really, just thinking about what to do next.
Mm-hmm. Did you try reaching out to her at home or her personal phone?
No, I haven't tried that. I don't know where she lives or her personal number. I wouldn't want to cross any lines or get her in trouble. I just thought maybe if I saw her at the hospital again, it would happen naturally. I haven't tried to contact her outside of work or anything like that.
Okay, I see. And I respect this perspective. Um, would you please tell me about if you are currently using anything to help you to coping with this thoughts?
Mostly, I just daydream about seeing her again or imagine what our life could be like together. Sometimes I write things down, like letters I'd give her if I ever got the chance. I listen to music that reminds me of her, or go for long bike rides to clear my head, but nothing really gets rid of the thoughts completely. It's just sort of how I get by for now.
Do you drink or use any kind of drugs?
No, I don't use any drugs. I have a drink now and then, but nothing out of the ordinary. I don't really use anything to escape. Just try to get through it on my own, mostly.
And did you notice that your drinking habits changed over this situation?
Maybe a little bit. I guess I've been drinking a bit more wine in the evenings when I can't sleep. Nothing crazy, just a glass or two to take the edge off. But it's not like I'm getting drunk or anything, just helps me calm down sometimes when my thoughts get too much.
Mhm. And could you please tell me what do you do usually when things get out of control? What means you use to cope with this situation, overwhelming feelings?
When things get really overwhelming, I usually just go out for a long ride on my bike, even late at night. It helps me clear my head a bit. Sometimes I write in my journal, just get everything out on paper. Or I'll put on my headphones and listen to music, try to drown out my thoughts for a while. Sometimes I just lie in bed and imagine talking to her. It's the only thing that really makes me feel better when things are bad.
Have you ever used any other risky means to cope with the situation?
Sometimes I probably take more risks than I should, like riding my bike too fast or not really paying attention to traffic. I don't really care much what happens when I'm in that state. I haven't done anything else dangerous on purpose, but I know the way I ride isn't always safe. It's just when my mind's racing, I don't think about the consequences as much.
Any other harming behavior?
No, I haven't done anything else to hurt myself. I don't cut or anything like that. It's really just the risky riding when I'm overwhelmed, but nothing more. I try to keep myself together even when it's tough.
Mm-hmm. I see. It must be hard. Um, so Thomas, if you have anything else to share with me and I didn't ask you about,
No, I think you've covered most of it. It's just, I wish people could see how real this is for me. Sometimes I feel like no one gets it, and that makes everything feel even lonelier. I just want things to make sense again, but that's about it, really.
and does that include experience where you sometimes hear voices or see things that other cannot hear or see?
No, nothing like that. I don't hear voices or see things that aren't there. It's all just in my head, my own thoughts and feelings, you know? I know what's real around me. It's just this feeling about Dr. Stone that's so strong.
I see. And what does makes you feel that others are hard, like the things is hard for others to feel what you feel?
I guess because when I try to explain it, people just brush it off or say, it's all in my head. They don't understand how powerful the connection felt or how much it's taken over my life. It's not like a normal crush, it feels deeper than that. So when others act like it's nothing, it just makes me feel more alone, like I'm the only one who can see how real it is. That's why I don't talk about it much.
It must be hard. So we will discuss how we can help you, and we will get to you back soon. Is that okay with you?
Yeah, that's all right. Thanks for listening. I just want to feel a bit better about all this. I'll wait to hear from you.
Okay, thank you so much, Thomas.
All right. Thank you, Dr. Rayner. I appreciate you taking the time.
دكتورة موجة.
So, I think Lena done good. Cover يعني all thing. Um, but not deep, deeply في ال risk assessment. Other than that, I think good presentation.
لينا اي فيدباك؟ انت حسيتي نفسك اشتغلتي كيف؟
Okay, overall, I think it was good. What went well, I believe, communication and presenting illness. يعني I felt وده jeopardize إنه أنا أمشي على الفول history كله. يعني there is areas that I didn't touch وكان mainly في المين complaint بتاع ال patients. Later to improve this, I believe the structure بتاع ال gathering history, full psychiatry history.
غايته انا يعني انت غطيتي ما شاء الله ماشي كويس، يعني انت you covered a lot of bases. في الاخر you collected the good information، الفلو كان ماشي معاه كويس، you expressed empathy، you collected his risk assessment. ف overall يعني ماشيين ما شاء الله في تحسن شديد يعني يعني covered all the points. ما اعرف اذا الدكتور عبد الغني عنده بوينت يعلق عليها.
شكرا لكم. It is just one word. Lina was excellent. To me, was excellent. I will give her 10 out of 10. Thank you.
Thank you so much, Yavas.
تمام غايته. عشان كده برضه دايرين more and more people to يعني just to do the same. انت بس يعني it's just a matter of practice. يعني عارف انه ساعات الناس ممكن تكون متخوفة، لكن it's a matter of practice. الناس ما تتهيب. The more you practice the more يعني انت you're gonna do better next time. لكن excellent.
Thank you so much.
طيب نمشي. Who's going to be next؟
لو في أي واحد من الترينيز برضو عنده أي كومنت ولا إضافة سريعة كده قبل ما نمشي للحالة الثانية يا ياسر.
Okay.
السلام عليكم ورحمة الله وبركاته.
عليكم السلام ورحمة الله.
Thank you all. Thank you, Dr. Lina. I think you did very well. and very nice communication skills, very nice language. This is good, and I think. But did you cover the part of offering a psychotherapy, and you explain the patient that he needs sessions of talking therapy, something like that.
طيب أنا just discussed مع البيشنت الهيستوري، لكن ما I didn't discuss المانجمنت، وزي ما قلت قبل في الفيدباك إنه ده was part of the shortage المانجمنت. But I communicated to the patient إن إحنا we will get back to him. However المانجمنت والdiagnosis أنا I didn't discuss this part with the patients.
تمام تمام يا بص، تمام يا دكتور لينا. عموما ما شاء الله. طيب أجل النقطة اللي أنا عايز أضيفها، طبعا هي this is erotomania، اللي هي طبعا كلاسيكالي اللي هو بيكون patient thinking that other one usually of high status is in love with him or her. البيشنت usually بيكون female، لكن هنا حصل العكس، male loving a female، اللي هي دكتور ستون اللي هو كان بيتكلم عنها طوالي وكده. ودي طبعا في الديزم 5 delusional disorder erotomanic type، لأن طبعا delusional disorder عنده several type، فدي ماشية مع إنها تكون delusional disorder erotomanic type. بس حبيت أضيف النقطة دي. ثانك يو.
شكرا يا خلف الله. اوكي، اي زول
العفو
عنده
يا بوس،
اضافه
الله يطول.
قبل ما نبتدي الكيس الثاني؟ انا عندي اضافه صغيره، يعني هي كفرت she covered almost everything، لكن لو ادوك 20 دقيقه افتكر يعني شفت شنو يعني ازول to use them all، ما بخلي لي دقيقتين. يعني هي she covered everything، ما في حاجه مثلا big يعني that needed to be covered في الكيس دي. لكن مثلا في الامتحان اصلك ما مثلا تخلص الا يكون الزمن خلص. لو مثلا انت you have to عندك particular time في الامتحان، ما تقوم بدري.
توتر يا بص بيخليك جاري.
لا لا عادي. اوكي، ال who's next؟
صراحة ما في زول جاهز، لكن ممكن نختار من الليستة أو متبرع.
هي ما عايزة جهوزية يا دكتورة مهجة، حقيقة ما عايزة جهوزية، الزول طوال يخش. يلا هو is the second، ما يكون عمل قبل كده.
السلام عليكم يا باص.
عليكم السلام ورحمة الله
السلام.
وبركاته.
أنا دكتورة رغد، بس كنت حابة أعمل حق توماس لأنه I don't know if I'm good at child psychiatry.
هو الكيس الثاني تشايلد سايكاتري
كان
يا ياسر.
سايكاتري هاي ممكن
أيوة.
خلاص
نمشي لكلارا.
غيرها وديها لي رغد تغير اللي بعدها بس.
اوكي نمشي لكلارا.
أوكي.
طيب رغد انت وين محلك؟
في الإمارات.
اوكي، ما المفروض شبكتك تكون كويسه صح؟ عشان بس احنا نشوف
أيوة.
اذا محتاجين باك اب ولا لا. لو زول شبكته
لا
مثلا
كويس
هجيبه
الحمد.
في لك. تمام.
كويس الحمد لله.
طيب حنمشي لكلارا. Clara the Pont is a 28-year-old woman who has been referred to your psychiatry clinic from a gastroenterologist. She has been experiencing frequent episodes of abdominal pain and shortness of breath. The gastroenterologist has ruled out gastrointestinal issue. Your task is to take psychiatric history and, if possible, attempt to discuss a possible diagnosis here. Pre-reading. Somatization disorder, according to the ICD-11, characterized by the presence of one or more chronic symptoms that are distressing and result in significant disruption of daily life. These symptoms cannot be fully explained by another medical condition or substance use. Understanding this disorder is crucial for medical practitioners, as it requires a comprehensive approach that includes medical evaluation, effective communication, and often a multidisciplinary treatment plan. ICD-11, somatization disorder, falls under category disorders specifically associated with stress. In the ICD-11, it emphasizes the importance of the symptoms not being intentionally produced or foreign. Diagnosis requires the symptoms to be persistent, typically for more than several months. NICE guidelines has not published guidelines specifically for somatization disorder, but offered guidance on managing medically unexplained symptoms, which somatization disorders fall under. NICE recommends a biopsychosocial approach, understanding biological, psychological, and social factors. Initial management include validating the patient's symptoms, avoiding unnecessary medical tests, and considering psychological intervention. Communication skills. Effective communication is vital when dealing with patients with somatization disorder. Here are key points to consider. Empathy and validation. Acknowledge the patient's distress without immediately attributing symptoms to a psychological cause. Clear and simple language. Avoid medical jargon that may confuse or overwhelm the patient. Active listening. Show genuine interest in the patient's experience and concerns. Setting realistic expectations help the patient understand that symptoms improvement is a gradual process. Symptom exploration. Can you describe the symptoms you are experiencing? How do these symptoms impact your daily life? History of symptoms. When did these symptoms start first? Have you noticed anything that makes your symptoms better or worse? Previous medical consultations. Have you seen any other doctors for these symptoms? What was discussed or concluded? Have you undergone any treatment or test for these symptoms? Psychological context. How has your mood been lately? Have you experienced any significant stress or changes in your life around the time the symptoms started? Functional and social impact. How have these symptoms affected your work, social life, and or relationship? What activities have you stopped or reduced because of your symptoms? Managing somatization disorder requires an honest approach that balances medical investigation with psychological and social support. As a medical practitioner, your role is not only to rule out organic causes, but also establish a therapeutic alliance with the patient, guiding them toward appropriate intervention. The OSCE simulation focusing on somatization disorder will test your ability to integrate your clinical knowledge with communication skills, ensuring a holistic approach to the patient's care. طيب رغد جاهزة؟
Okay, yes, جاهزة.
اوكي تفضلي.
Good afternoon. I'm glad someone is finally taking this seriously. Where shall we start?
Good afternoon, Clara. I am Dr. Ragad, a psychiatry trainee, and I'm gonna help you today, okay?
Okay, merci. I really hope you understand that what I'm feeling isn't just in my head. The pain and the breathlessness are so real, even if all the tests say otherwise. It's been exhausting, honestly. I'm scared there's something being missed.
Yes, your feelings are very valid. And now I'll go through with all the things that you present with, and I'm going to try my best to help you through it.
Thank you for saying that. It means a lot to feel heard for once. Sometimes I worry that people just think I'm exaggerating, but I promise these symptoms are really affecting my life. I just want to get back to feeling normal, or at least not be so afraid all the time.
Okay, can you tell me more about these symptoms, Clara?
Sure. For about 6 months now, I've had strong abdominal pain that comes and goes, and sometimes I suddenly can't catch my breath properly. It can happen anywhere, at work, at home, even just walking outside. When it starts, I feel panicked and I have to stop what I'm doing. It's embarrassing and scary, especially since no one can find a real reason for it.
Okay. What made you feel better about what makes this pain feel less severe or helps you feel better?
Sometimes, if I lie down and focus on my breathing, it can calm down a little, but not always. There are days when herbal teas or remedies my mother suggests seem to help a bit, but it's not consistent. Distraction sometimes works. If I'm deeply focused on something else, I might not notice the pain as much. But honestly, most of the time, nothing really takes it away completely. It just lingers until it decides to pass.
Did you notice that it happens before certain occasions or particular times?
Now that you ask, I think it does get worse before big meetings at work or important events. If I know I have to speak in front of people or there's a lot of pressure, I get really anxious, and then the pain or the breathing issues often show up. But it's not just then, it sometimes happens completely out of the blue, even when I'm at home relaxing. So, yes, stress makes it worse, but it's not always predictable.
Okay. That must be really hard, Clara. Did you ever consult another physician about these symptoms?
Yes, I've seen several doctors already. I've had a lot of tests, blood work, scans, even saw a gastroenterologist. Everything keeps coming back normal. Some of them suggested it's just stress, which honestly makes me feel dismissed. I wouldn't be here if it was that simple for me.
Yes, sometimes stress can affect your body physically. Can you tell me about your work environment?
My work environment is quite fast paced. I'm in marketing, so there are always deadlines, presentations, and a lot of expectations. I used to handle stress well, or at least I thought so. But lately, I feel overwhelmed almost all the time. I worry I'll have an episode during a meeting, so I've started avoiding certain tasks or even calling in sick sometimes. It's frustrating because I used to really enjoy my job.
Hmm. Did this affect our other aspects in your life?
Yes, definitely. It's affected my social life a lot. I avoid going out with friends because I'm scared the pain or breathlessness will hit when I'm out. Even with family, I feel distant. They worry, but sometimes it just feels like more pressure or anxiety. I'm not as present as I used to be. It's like I'm always waiting for the next episode to happen.
Mm. Okay. With all this going on, can you tell me how your mood is?
Honestly, my mood is all over the place. I feel anxious most days, especially when I think about the symptoms or worry they'll come back. Sometimes I feel really low, frustrated, hopeless, even angry that no one can give me answers. There are days where I just want to stay in bed and avoid everything. It's exhausting trying to keep up a normal face when I'm struggling inside.
Mm. Your feelings are validated. How do you cope with these days, Clara?
I try to keep busy, work, reading, anything to distract myself. Sometimes I do breathing exercises or drink herbal tea, like my family taught me. On really bad days, I just let myself rest, even if it means canceling plans. I also look up information online, hoping I'll find something that explains what's happening. But honestly, it's hard. Most coping methods only help a little, and the anxiety still finds me.
Okay. Uh, how do you feel after looking things online?
Looking things up online can be a double edged sword for me. Sometimes it helps to know other people have similar symptoms, but most of the time it just makes me more anxious. I end up reading about all these rare diseases and worst case scenarios, and then I get convinced something serious is being missed. It gives me temporary comfort, but then the fear comes back even stronger.
Even after seeing all the results, the test results and investigations, you still feel this way.
Yes, I do. I know the tests say nothing is wrong, but my body keeps telling me otherwise. It's really hard to just accept everything is fine when I still feel pain and can't breathe sometimes. I want to trust the results, but I can't ignore how real these sensations are. It makes me feel lost, like I'm not being understood or believed.
Okay. What do you think these symptoms might suggest?
Honestly, I don't know anymore. At first, I thought maybe something was wrong with my stomach or my lungs. Every doctor says I'm fine. Sometimes I wonder if it's something more serious that's just not showing up yet. Other times, I think maybe my anxiety is making things worse, but it doesn't explain why it feels so physical and intense. I just want to understand what's happening so I can get my life back.
Okay. I want to reassure you, Clara, that as long as the investigations are okay and at the normal ranges, it might be the stress that is actually affecting your life.
I get that stress can cause a lot, but it just doesn't feel that simple for me. The pain is real. I can't just wish it away or ignore it. I've tried convincing myself it's only stress, but it doesn't make the symptoms stop. I really need someone to take this seriously and help me figure out what's actually going on.
Okay, Clara, I will try my best to help you. Can you tell me more about your sleep and appetite this past period?
My sleep has definitely gotten worse. I struggle to fall asleep, and when I do, I wake up a lot during the night. Sometimes because of the pain, sometimes from anxiety. I feel tired most mornings. As for my appetite, it's not great. Some days I can't eat much at all, especially when the pain is bad or I'm really anxious. Other days I force myself to eat just to keep up appearances.
Mm. Okay, why do you find it hard to sleep, Clara?
I think it's mostly because my mind won't stop racing. I keep worrying about when the pain or breathlessness will hit again, or if something serious is being missed. Sometimes I replay stressful moments from work or things people have said. Even if I'm exhausted, I can't seem to relax enough to fully rest. It's like my body and my mind are both on edge all the time.
Okay. What about your appetite?
My appetite is really up and down. When the abdominal pain is bad, I just can't bring myself to eat much. Food feels unappealing or even makes me nauseous. On other days, if I'm anxious, I might forget to eat altogether. There are rare times when I eat normally, but those days are less common lately.
Mm. Did you notice any weight loss this past period?
If you mean weight, yes, I've noticed I've lost a bit. My clothes fit looser, and some people have commented on it. I didn't try to lose weight, it just sort of happened because eating has been difficult with all this going on.
Yes, it must be hard for you. Uh, did you ever,
It is hard.
yes. Did you experience any other pain?
Not really, no. The main pain is in my abdomen. Sometimes I get
Mm.
headaches, but nothing compared to the abdominal pain. That's the one that really worries me and takes over everything else.
Okay. Do you notice these symptoms are mostly uh, exaggerated around stressful times in your life?
Yes, they're definitely worse when I'm stressed. If I have something big coming up at work, or if there's tension with family or friends, the pain and breathlessness are so much stronger. But they don't only happen then. Sometimes it's completely random, even when things seem calm. So stress makes it worse, but it's not the only trigger.
Okay. What are the other triggers that you noticed also?
It's hard to say exactly. Sometimes it just comes out of nowhere, even if I'm doing something relaxing like reading or watching TV. Occasionally, certain smells or memories can make me tense, but most of the time, I can't find a clear reason. It's unpredictable, which makes it even more stressful.
Okay. At the start of our session, Clara, you told me 6 months ago these symptoms started, right?
Yes, that is right. It started about 6 months ago. At first, I thought it would just go away on its own, but it kept getting worse.
Did you notice that 6 months ago something particular happened that led to it?
Not really, no. There wasn't a specific event that I can remember around that time. It just sort of began gradually. I was busy at work, but nothing out of the ordinary happened that could explain it. It's frustrating not having a clear reason for why it all started.
Okay. We'll try to help you. Okay, Clara?
Thank you. I really appreciate that. I just want to feel like myself again.
It's okay. We'll try our best. It's a multidisciplinary approach, so you will get help from several other departments other than psychiatry. Step by step, you will get yourself back to the best state you want.
Merci. That does help to hear. I just want someone to stick with me through this, even if it takes time. I'm willing to try whatever you recommend if it means I can get some relief.
Okay, I'm glad, Clara. Can I ask you about your feelings toward all of this, and if you ever thought about self-harming yourself or ending your life?
I appreciate you asking. I felt really low and overwhelmed at times, but I haven't wanted to harm myself or end my life. Mostly, I just feel desperate for answers and really frustrated. I want these feelings and symptoms to stop, but I still want to get better and find a way out of this.
Okay. You will definitely be better, Clara. Are you open to
Thank you.
try different interventions in therapy
Yes,
wise and
open to
drug and
trying different
treatments?
interventions. At this point, I just want to find something that helps. If you think something could make a difference, I'm willing to give it a chance.
Okay. Does anyone in your family, Clara, have the same presentation or suffered from this same presentation?
Not exactly the same symptoms, but anxiety runs in my family. My mother and my sister both struggle with it, especially during stressful times. They've had physical symptoms like headaches or stomach aches, but nothing as intense or long lasting as what I'm experiencing. Sometimes I wonder if it's somehow connected.
Yes, it might be connected because these things runs in families. But after further assessment, we can find out your diagnosis.
That makes sense. I just want to understand what's happening to me. If it helps to look at my family history, I'm okay with that. I just hope we can finally figure this out together.
We will figure it out, Clara. Is this your first psychiatric presentation?
Yes, it is. I've never seen a psychiatrist before. I always try to handle things on my own or with my family's help, but this time it feels too much. That's why I finally decided to come here.
Okay. Did you ever have any other means of coping? Can you tell me more about it?
Mostly, I rely on distraction, working late, keeping myself busy, or reading a lot online about my symptoms. Sometimes I try herbal remedies or teas.
Okay, did you try any other drugs or smoking?
No, I haven't tried. No, I don't smoke. Never have.
Okay. Do you have any other medical symptoms or medical diagnosis?
No, I don't have any other medical diagnoses. Other than these symptoms, I've always been pretty healthy.
Okay. Are you taking any drugs or medications?
No, I'm not taking it. No, I'm not taking any medications at the moment. I haven't been prescribed anything for these symptoms.
Okay, not even by your past doctors?
No, not really. Some suggested over-the-counter painkillers or antacids, but nothing ever seemed to help much. No one has given me any long-term medication or specific treatment.
Okay.
All right. If you need to know anything else, just let me know.
Okay, Clara, we will further have you and discuss with you your treatment plan. And I hope you eventually feel better, because you will feel better.
Thank you. I really hope so too. I appreciate you taking the time to listen and not dismissing how I feel.
No, your feelings are valid, Clara.
Thank you for saying that. It means a lot to feel understood for once.
Okay, thank you, Clara.
طيب رغد، انت عندك اي كومنت على هناي على الاسسمنت قبال ما نسال السوبرفايزرز؟
I think كان ممكن أكون more ordered يعني، أو organized أكتر.
من ناحيه شنو؟
I don't know، بس بحس إنه لما يكون ال key points يعني اللي هما بيطلبوها it's like written، الواحد شوية بيكون ما مركز هو المفروض يقول شنو أو عايز يقول شنو.
هو ساعات احسن انت ذاتك ما تكون عارفه الكيس شنو، عشان ما تلخبط روحك.
Yeah.
يعني انت لما تخش ساكت كده ده you don't know what is happening. ساعات بتبتدي in a very systematic way.
أيوة فعلا.
لكن ما كان في جلطه شديده، انا ما شايف في جلطه شديده اساسا ولا disorganization. ساعات يعني الفلو بيكون ماشي مثلا depending on what the patient is sharing، لكن انت بترجع بعدين تمشي systematic. ما كان في يعني it was not disorganized.
Okay.
دكتوره مهجة؟
آه أنا برضو بعتقد إنها هي يعني done well. وحاجاتها ماشية كانت سموث. بس في حتات كده في النهاية يعني يمكن عشان الزمن بقى طويل عليها ولا ما عارفة حصل شنو،
أيوة فعلا.
فبقت بتمشي وترجع تاني.
صح.
يعني شوية يعني بقت away يعني إنها هي ما كانت سيستمتايز في النهاية يعني، لكن عموما يعني done very well.
Okay, thank you, doctor.
دكتور عبد الغني؟
شكرا دكتورة راغد. and I think زي ما قال ياسر قبل we are improving much and much. It was excellent again, another excellent interview. بعدين don't worry about انك you ask questions in a non-systematic way. There is no problem. البروبلم الوحيدة انه لما زول يكون ما systematic can miss some parts of the history.
Yes.
لكن احنا دائما بنمشي مع البيشنت، يعني الكلام اللي بيقوله البيشنت. لكن when you present the case to your
Yes.
supervisor during the exam you should be systematic. ما حتكوني بالصورة بتاعت الانترفيو مع البيشنت براكم. a systematic way of approaching a patient is the best طبعا. لكن we cannot do this always. ليه؟ لأنه البيشنت يا اخواننا عنده priority اكتر مننا نحن، هو عنده حاجات عايز يقولها فبنمشي معاه. لكن زي ما قلنا في الاسبوع الماضي we should control الانترفيو، يعني كنترول التايمينج ولا المانج التايم بتاع الانترفيو. لكن don't worry انك سالتي اسئله هنا بعدين مشيتي سالتي عن اسئله ثانيه. This is no problem as long as when you present your case you present it in the same systematic format we all familiar with. Thank you.
Okay. Thank you, doctor.
السلام عليكم.
وعليكم السلام ورحمة الله. دكتور
مرحبا يا
عبد
شباب.
الزعيم معنا دكتور عبد الله عبد الرحمن، مرحبا بك، تفضل.
كيف الحال؟ I think this lady has done a perfect interview. One remark is that I felt that you are more confident than the ladies last last week, but you still to have more confidence. You kept saying some phrases. We are going to do our best to help you. You said this about 5 times. This will just put some shadows on your confidence. Like, and otherwise, you're perfect. That's good. And
Thank you, doctor.
and the language is okay. It's okay,
Thank you,
really.
doctor.
Yeah.
عشان كده it's every time الموضوع ده ماشي في تحسن يعني عشان كده we should not be avoiding it. The more we practice, the more we listen, the more we do, the more we're going to be learning two things هنا. أول حاجة ال interviewing skills ذاتها وبعد شوية communicating in English language. فالناس ما not to shy away و they should يعني receive the feedback and work. يعني في الآخر أنت الليلة لو حصل مثلا ما تسهلت معاك ما توفقت لا just practice again and again. Next time it's going to be better and better واحنا كلنا ماشيين في تحسن.
اوكي ان شاء الله.
طيب who will be next؟ لو في يزور عنده interest في الكيس بتاعت الchild psychiatry موجودة.
افتكر والله مهمة كونه ذاته معانا دكتور عبد الله child psychiatrist، فأحسن ناخدها حتى لو صعبة ولا فيها difficulties there is no problem. أي واحد من الشباب ياخدها أو الشابات يلا.
وبعدين this
وعبد
is
الله
17 years old يعني somebody who can tell you a good
أيوه
history. ما
yes
مثلا you're not communicating with the family هنا you're communicating with the patient herself.
Yeah, it's
anyone
fine. Who volunteers?
نختار لكم من الناس السينيور. طيب أنا عندي لسه قدامي والله من قبل ما عايز أختار، بس عشان قلنا الزول الفولunteer is better than being pointed at يعني، لكن عندنا ناس سينيورز ولسه ما قدموا.
Would you please I can take it بوست
نو
دكتور عبد الغني.
نو معلش يا خلف الله، انت والله ما شاء الله عليك مشارك واي حاجه وشاركت كثير وشكرا لك كثير حقيقه. I am proud of you، لكن بس عايزين ندي فرصه لناس ما
العفو
شاركوا يا
بس
خلف الله،
العفو.
ده الهدف. ايوه ده الهدف. شكرا لك.
اوكي يا ابو اوكي ما في واجب ما في واجب. العفو العفو يا استاذ، جزاك الله خير.
يلا شباب، يلا شابات. اها اها خش خش خشوا طوال يا اخي، ما محتاجه قصه لتفكير. No one is going to
Yeah.
harm you. No one is going to judge you. No one is going to judge you. It is just a training program. It's just a training program. Hmm?
I
شباب.
think you should. I think you choose one of the guys. R4 or R3.
بحس لما قلنا عايزين وين we choose من 63 بقوا 56. عين ما عايزين جينيس ده يا
بص
اخواننا.
انا اوريدي قبل كده عملتها، لكن ممكن اكون باك اب يعني لو ما في حد يتبرع بتراي يعني.
لا احسن من الناس اللي ما عملوا يا جماعه. لازم ندي
أيوة.
شانس.
شكرا لك شكرا لك، لكن لسه
شكرا
انا
لك.
متاكد انه في زول حيتقدم او زوله يعني يدوك صدره يتقدم. There is no problem at all. No one is going to judge you. There is no problem.
الا تعمل
يلا
حوافز
شباب.
يا سيد الرئيس.
والله الحوافز لا يعني الحوافز ليهم هم، كونه انا اتقدم واخش في كيس حتى لو I find difficulties definitely I gained. الجيننج هو الحافز حقيقة. الجيننج هو الحافز، ف whoever comes in will gain يعني.
بعدين 17 years old lady is just like an adult يعني، مع بعض التحويرات.
ايوه وأنا دكتور عبد الله. دكتور عبد الله will definitely will help يعني. لأنه أصلا اشتغل في child psychiatry يعني. ف who's going to take it يا شباب؟ who's going to take it؟
ما بعدين تلقى البوديوم فاضي كمان.
لا إن شاء الله. الشباب 56 نفر قاعدين لسه. ف... طيب يلا يلا دكتورة هالة حسن خوجري. هالة حسن خوجري دفعة 48. يلا يا ماما خشي، ما في مشكلة يا هالة. عبد الله ولا هيلب؟
yeah no problem.
48. تفضلي دكتورة هالة.
دكتورة هالة موجودة؟ خلاص؟
أيوة.
طيب
موجودة.
وين محلك
يلا.
وين؟ بس أتأكد عشان
لا ما فتحت الميكروفون لسه.
ايوه هم ميوت.
عاملة ميوت. يلا يا دكتورة هالة unmute yourself and come forward please. عاد نبقى زي لسه.
وينها هلا؟
مكانك وين أنت ذاته عشان بس أنا أعرف الشبكة كيف.
دكتورة هالة حسن خوجري أنت في الجروب يا إخواننا، شايفين اسمك. ده الكلام اللي احنا كنا خايفين منه وقلناه الاسبوع الماضي. ما تخش اونلاين و you just leave المنصة والبلاتفورم and you go. يا هدوء وصلت. يلا يا هالة تفضل يا ماما. هالة انت وين يا هالة؟
السلام عليكم يا بص، سامعني؟
السلام. سامعينك يا ماما. انت وين يا هالة؟ حتتك وين عشان الشبكة بس؟
أنا موجودة. لا، أنا موجودة في القاهرة، بس الشبكة شوية مرات بتفصل يعني، لكن إن شاء الله
ما
will do
في
يعني.
بإذن الله. يلا دو. ما في أي مشكلة. There is nothing wrong, nothing right. It is just at any time you feel that you want to stop the interview, you have the full freedom to stop it. Okay? As you like يعني. ما في مشكلة. تفضل يا ماما. يديك
إن
العافية.
شاء الله it will go fine.
طيب Ananya Kapoor. Ananya Kapoor, a 17-year-old schoolgirl who has came to you. She's a young girl who is a professional musician and is concerned about her upcoming international tour. She has a previous diagnosis of ADHD and is currently on medications. She's worried that her symptoms might affect her performance and is also concerned about traveling with medications. Please speak to the patient to take a psychiatric history and confirm her previous diagnosis of ADHD. If possible, try to identify her current issues and address any concerns she may have. هي من الآخر هنا أفتكر في النكست ستيب حيورينا على السيمتومز بتاعت ال ADHD. الكويستنز المفروض نسألها هي عندها specific question about the trip غير يعني it's a psychiatric assessment with a focus on ADHD. any potential associated symptoms مع اللي هي ال ADHD اللي مثلا الليلة في ever anxiety في depression في OCD في حاجة تانية ولا لا وبعدين الفوكس on her questions. Communication skills and history taken in adolescent ADHD. Attention deficit hyperactivity disorder is a neurodevelopmental disorder characterized by persistent pattern of inattention, hyperactivity, and impulsivity. According to the ICD-11, it falls under category of disorders of neurodevelopment. The etiology of ADHD is multifactorial, involving genetic, environmental, and psychological factors. Genetic predisposition, prenatal exposure to alcohol or tobacco, and low birth weight are some of the risk factors associated with ADHD. In the UK, the lifetime prevalence of ADHD is estimated to be around 3 to 4%. It is more commonly diagnosed in children, particularly boys, but many adults also live with the condition. Patient often presents with symptoms such as inattention, difficulty sustaining attention, forgetfulness, hyperactivity, fidgeting, inability to stay seated, and impulsivity, interrupting conversations, making hasty decisions without considering the consequences. Attention deficit hyperactivity disorder in adults is a neurodevelopmental disorder characterized by persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. As healthcare professional, it is crucial to understand the complexities of ADHD, especially when managing patients with unique lifestyles, such as professional musicians who travel internationally. This pre-reading material will guide you through understanding ADHD according to the ICD-11 NICE guidelines, effective communication strategies, and tailored questions to ask the patient. Ananya Kapoor. The National Institute for Health and Care Excellence Guidelines, NG87, emphasizes a comprehensive assessment for ADHD, which include obtaining a detailed psychiatric history and considering the impact of symptoms on the patient's social, academic, and occupational functioning. It is also recommended considering the patient's mental health and well-being, especially when they are involved in high-pressure professions. History taking. Identify the issues and priorities present in the scenario. Evaluation. The candidate should quickly identify that the patient's primary concern are her upcoming international tour, the impact of her ADHD symptoms on her performance, and the logistics of traveling with medications. Example phrases. Miss Williams, I understand you are concerned about your upcoming tour and how your ADHD might affect it. Let us discuss this in details. To recognize the significance of aspects of history evaluation, the candidate should inquire about the patient medical history, specifically focusing on the diagnosis and engagement management of ADHD, and understand the baseline and any changes in symptoms. Example questions. When were you first diagnosed with ADHD? What medications are you currently taking? Elicit and explore relevant symptoms, details in the history. Evaluation. The candidate should ask targeted questions to explore how ADHD symptoms manifest in the context of patient professional life as a musician, including any specific triggers or situations that exacerbate symptoms. Example questions. Can you describe how your symptoms manifest during your performance? Do you notice any specific triggers? Demonstrate adequate skills in risk assessment. Evaluation. The candidate should assess the risk associated with missing medication doses, the impact of symptoms on performance, and any potential legal issues with traveling with medications. Example, have you ever missed a dose of traveling? What happens when you do? Pay sufficient attention to patient's physical health and views. Evaluation. The candidate should acknowledge the patient concerns about traveling with medications and discuss practical solutions or alternatives. Examples, phrases. I understand you are concerned about traveling with medications. Let us explore the best ways to manage that. Identify appropriate psychological or social information. Evaluation. The candidate should explore how ADHD affect the patient's social interactions, both in professional setting with colleagues and in her personal life. Example questions. How do you feel your ADHD affect your relation? How do you feel your ADHD affect your relationship with your colleagues and family? Communication. When communicating with the patients like Nania Kapoor, empathy, active listening, and clear jargon-free explanations are key. It is important to validate her concerns about her performance and the logistics of traveling with medications. Creating a supportive environment will encourage her to share experience and concerns openly. Tailored questions for Ananya Kapoor. Given the task to take a psychiatric history and confirm her previous diagnosis of ADHD, while also addressing her current issues and concerns about traveling with medications, consider the following questions. Can you tell me more about how your ADHD symptoms have been affecting you recently, especially in relation to your work as a musician? Have you noticed any changes in your patterns, in your attention span, organization, or time management that have been particularly challenging? How have you been managing your ADHD symptoms so far? Have you experienced any side effects from your current medications? Could you share your concerns about traveling internationally with medications? Are you worried about logistics, legal issues, or something else? How do you feel your ADHD might impact your performance during your tour? Have you had any previous experiences traveling with medications that you found challenging? What support system do you currently have in place, both personally and professionally, to help manage your ADHD symptoms? It is essential to approach Anania's concern holistically, considering both the clinical aspects of ADHD management and the practical implication of her profession and travel plans. Familiarize yourself with legalities and guidelines regarding traveling with medications and provide Anania with practical advice and reassurance. Remember, the goal is to ensure she feels supported and confident in managing her ADHD symptoms effectively during her international tour. افتكر بس قبل ما نبتدي حبة شوية عن حياتها اللوجيستكس. Usually ADHD medications or stimulants لما يدوك prescription it does not exceed a month. ما في زول بيصرف لك أكتر من شهر معظم الأماكن. تاني حاجة افتكر يعني if you have a prescription يعني medication في المطار زي ده which is a controlled medicine without evidence it's prescribed it can be a problem. Some of the logistics is to have evidence to show that this is as it is a prescribed medication from your doctor. عشان كده مثلا في part of the discussion how you want to show this as an evidence يعني a letter ولا evidence that this is يعني a prescribed medicine from your doctor this can help يعني solve some of these concerns. دي للباك جراوند بتاعتك عشان discussion. انا ما اعرف اذا الدكتور عبد الله عبد الرحمن عايز to add anything هنا على اللوجيستكس قبل ما نبتدي الكيس.
لا it's okay especially we concentrate on the prescription issues and the whether to have some a report, a short report perhaps from our doctor, treating doctor or so. That's it.
اوكي. جاهزة؟ هلا؟
أيوة يس إن شاء الله.
طيب تفضلي واحنا في الباك جراوند.
Who's the lady? Who's
أنانيا.
Hala.
اي.
Hala. Yes.
اوكي.
أيوة.
Yeah, come on.
Good morning. I'm feeling a bit overwhelmed with the thought of my upcoming tour. There's a lot that could go wrong with my ADHD, and I'm not sure how to handle my medication while traveling.
Good morning, Anania. I'm Dr. Hala. I'm the psychiatrist today, and I'll be talking to you to be able to help you in the best way. Did you come here alone, or is there anyone else with you, Anania?
Hi, it's Ananya. Actually, I came by myself today. My parents are both working at the university right now, so they couldn't make it. But I've spoken to them about this appointment, and they know I'm here.
Okay, so Anania, could you start by telling me what brought you here today?
Well, I have this big international tour coming up with the orchestra, and honestly, I'm quite anxious about how I'm going to manage my ADHD while I'm away. My medication, Concerta XL, is really important for me to stay focused, especially during long rehearsals and performances. I've heard that carrying these meds across different countries can be tricky with all the regulations, and I really don't want any problems at the airport or anything like that. So, I wanted to talk about how to handle my medication when.
I understand, and you have every right to worry about those logistics, and we will try to find the best way to make things go smoothly. Have you ever traveled before for such an event, or is it the first time?
I've traveled before for performances, but never for something this long or to so many countries in one go. Usually it's just been short trips, maybe to Delhi or Chennai, or a couple of times to Singapore for competitions. This time it's a full tour, Europe and the US, for several weeks. So it's a lot more complicated, and I'm really not sure how strict the rules will be in all those places. It's making me a bit nervous, especially since I can't afford to mess up my medication routine.
I understand, and sounds like a big event and very important thing for you. in your previous traveling, even the short trips that you went through, was there anything in particular worried you or anything happened?
Not really, nothing major happened before. I mean, when I went to Singapore, my parents made sure we had a letter from my doctor about my medication, just in case. But honestly, no one even asked about it at the airport. For trips inside India, it's never been an issue. But this time, since I'll be alone for parts of it and going to so many different countries, I'm worried something could go wrong. Like if they question me about my meds or think it's something suspicious. I just want to be.
Hello?
Are you still there?
Yes, I'm here. I'm listening to you. So tell me, what is it that is bothering you the most? Is it about the symptoms or is it about the medication and the legal aspects?
It's mostly about the medication and all the legal stuff, honestly. I mean, I know how much I need it to function properly, especially with all the rehearsals and performances. If I lose access to it, or if they take it away at customs or something, I don't really know what I'd do. And also, the schedule for the tour is really packed. So I'm worried about keeping my routine consistent, like remembering to take it on time and not running out. The symptoms are always there in the background, but right now it's.
الصوت بيقطع، ما أعرف ليه يا ياسر، الصوت
أيوة
بيقطع.
أنا ما فاهمة.
أنا أفتكر بس تواصل مسألة تاني. You can tell her like من أي what يعني just what happened.
Hello?
Oh, sorry. I think I lost track for a second. So, yeah, what bothers me most is the medication stuff, the legal side, and making sure I have it with me through all the countries on the tour. I'm also a bit anxious about keeping my routine since the schedule will be so hectic. The symptoms of my ADHD are tough, but I'm more worried about something going wrong with the meds and not being able to perform at my best.
I understand, and it sounds like a tough time, and you need a lot of arrangement, and I understand that. Let me first start with your symptoms. How are you feeling now? What symptoms exactly are you experiencing right now?
Right now, I'm kind of restless, like I keep fidgeting and my mind keeps jumping around. It's hard to just sit still and focus, honestly. I noticed I'm more distracted than usual because I've been thinking about the tour non-stop. Even while we're talking, my thoughts keep drifting to my rehearsal schedule and packing lists and stuff. Sometimes I get this urge to just get up and move or do something else, even though I know I should be paying attention. It's a bit worse lately because. Are you still there?
Yes, I'm here. I'm listening. So you said that you feel like your thoughts are going rapidly and you're fidgeting and you feel restless. And I'm really sorry to hear that. If you feel like you're overwhelmed in this interview, we can take a break, you can relax, and we can continue. Are you okay?
I appreciate that. Thank you. I think I'm okay to keep going. It helps a bit to talk about it actually. I just get a bit scattered sometimes. So sorry if I go off track. I want to sort this out properly before the tour, so I'd like to keep going if that's all right.
Yes, okay, all right. We will go through it all and we will discuss your concern and hopefully everything will be good. Just try to relax and keep breathing, okay? So what other symptoms are you experiencing now? Do you feel like you do things impulsively and do you have difficulties organizing your thoughts or organizing your things and managing your time?
Yeah, I definitely struggle with impulsivity sometimes. Like I'll jump into something without thinking it through, especially when I'm excited or stressed. With organizing, it's a challenge. My room and my violin case get messy really quickly, and I end up losing things like sheet music or my tuner all the time. Managing time, that's hard too. If I get really into practicing, I can lose track of hours, but other times I get distracted and forget important stuff like assignments or even taking my meds on time if I'm not careful.
And do you find it challenging to pay attention and to sustain this attention while you are doing your activities?
Yes, that's definitely a problem for me. If it's something like practicing violin or performing, I can hyper focus and lose track of everything else. But with other tasks like studying, listening in class, or even just daily chores, my attention drifts really quickly. I zone out or get distracted by the smallest things. So, yeah, sustaining attention is tough unless it's something I really love or if there's a lot of pressure.
I'm sorry to hear that. And what about your activity and your energy? How do you feel it?
I usually have a lot of energy, honestly, sometimes too much. Like, I find it hard to sit still, and even when I'm tired, my mind keeps buzzing. I get restless if I have to stay in one place for long, especially if I'm not playing music. It can be helpful when I need to practice for hours, but it also means I sometimes end up overdoing it and then crashing later. So, my energy is kind of all over the place, either super high or just exhausted.
And do you tend to start a certain task and then shift to another task before finishing the first?
Yeah, that happens a lot. I'll start practicing a piece, then remember I need to reply to a message or check something for school, and just switch without thinking. Or I'll begin packing, then get distracted by something else in my room, and suddenly I'm doing three things at once and none of them are finished. It's frustrating because I want to get things done, but my brain just jumps around.
I understand it must be really hard to go through all that. And how is it affecting your life? I mean, your
It
academic
affects a
life
lot,
and
honestly. Like, ma sometimes I get behind on homework or forget important things for school. With music, I can hyper focus, but I also get distracted during long rehearsals if my meds wear off, which isn't great in front of the orchestra. My room and stuff are always a mess, so I waste time looking for things. Socially, I miss out on time with friends because I need more time to finish everything. It just makes everything feel a bit more stressful and chaotic.
how are your grades and your academic performance?
My grades are still pretty good, but it takes a lot of effort to keep them up. I have to work extra hard to stay organized and remember deadlines. Sometimes I forget assignments or leave things to the last minute because I got distracted by music or something else. It's stressful, but I really try to keep my academics strong since my parents care about it a lot and I don't want to let them down. So far, I've managed, but it's definitely not easy.
Okay, and are there any specific things you do to help you complete your activities and do what you are supposed to do?
Yeah, I try to use reminders on my phone for almost everything, taking my meds, practicing, homework. I keep a planner and write down all my deadlines and rehearsal times. Sometimes I set alarms to help me switch tasks so I don't lose track of time. My parents help me organize my schedule if things get too overwhelming. And I try to break big tasks into smaller steps so they feel less impossible. It's not perfect, but these things make it a bit easier to manage.
That sounds really good, and I hope it helps you more. And do you feel like you have the support you need to go through all that and to face all those challenges?
Yeah, I do feel supported most of the time. My parents are really understanding and they're always willing to help, especially when I'm struggling with routines or feeling overwhelmed. My teachers and music mentors are supportive too, and they know about my ADHD, so they are patient if I need extra time or reminders. My friends try to help, but sometimes it's hard for them to really get what it's like. Overall, I know I'm lucky to have people who care, but I still worry about handling everything when I'm on tour by myself.
I'm glad you feel supported. And how is it affecting your mood? How is your mood now?
I feel supported because my parents check in with me daily, remind me about my meds or important things, and help me make plans if I'm stressed. My teachers will sometimes give me extra time if I need it, especially when I'm traveling. My mentors in music always ask how I'm doing, not just about my playing. It makes me feel like I'm not alone with all this. About my mood, it goes up and down. When things are organized and working, I feel pretty good, even excited. But when I get overwhelmed or
Hello?
yeah, sorry, I'm here. Sometimes I just lose my train of thought when I'm trying to explain things.
Okay. It's
What I
alright.
was saying is, when things get messy or I can't keep up, my mood definitely drops. I get frustrated and anxious, especially if I feel like I'm letting people down or missing something important. But having support helps me bounce back faster, I think.
And are you sleeping well and eating well?
I try, but honestly, it's not always easy. When I'm really busy or distracted, I sometimes forget to eat or just grab whatever's quick. My parents remind me, and when I'm home, meals are regular. But when I'm practicing a lot or during concerts, my eating habits can get a bit all over the place. I know it's important, especially with my medication, so I'm working on being more consistent.
Okay. And when you feel so overwhelmed with all those things that you have to do you sometimes feel like life is not worth living and that you can't take it anymore?
No, I don't feel that way. I do get overwhelmed and frustrated sometimes, but I have never felt like life isn't worth living. If things get too much, I usually talk to my parents or someone I trust. Music helps me cope when I'm stressed. I know I have support even when things are hard.
And this is good to hear. So just to make sure uh, you never had any thoughts about harming yourself or doing anything to harm yourself?
No, I've never had those thoughts. Even when I'm stressed, I don't think about hurting myself. I just get frustrated or anxious. But I always try to find ways to deal with it, like talking to someone or playing music.
I'm glad to hear that. So tell me, Anania, for how long have you been diagnosed with ADHD?
I was diagnosed when I was 14, so it's been about 3 years now. Before that, I always struggled with focus and being hyper, but I didn't really understand why. Getting the diagnosis helped explain a lot of things and made it easier to find ways to manage it.
And what medication are you on now?
I'm taking Concerta XL 36 mg once a day. I've been on that dose since I was diagnosed, and it's helped me a lot with focus, especially for school and music.
Do you experience any side effects? Does it make you feel unwell in any way?
Sometimes I get a bit of a headache when I first take it, or I don't feel very hungry for a while. Occasionally, I feel a bit jittery, especially if I haven't eaten properly, but overall, nothing too serious. Most days, I feel okay on it, and I think the benefits outweigh the side effects for me.
That's really good. Are you on any other medications?
No, just the Concerta XL. I'm not taking any other medications right now.
Even medication without prescription? Have you tried any?
No, I haven't. I only take what my doctor prescribes. I wouldn't try anything else, especially with all the traveling coming up. I want to be careful and avoid any problems.
Okay. Do you have any physical problems that I should know about or any medical diagnosis apart
No, I
from
don't
your
have any other
ADHD?
medical problems or diagnoses. I'm generally healthy apart from the ADHD.
Okay. And is there anyone in the family has similar symptoms or any psychiatric problems?
No one in my family has ADHD, at least not that I know of. My parents are both professors, and my younger brother is pretty focused, honestly. I think I'm the only one with these kinds of symptoms. There's no history of any psychiatric problems in my family either.
Okay. So, regarding your medication and your current trip, you told me that you are worried about taking the medication with you. Are you worried about the legal aspects of the medication?
Yes, exactly. I'm worried about the legal side of things. I know some countries have strict rules about bringing in medications like Concerta, and I really don't want to get into trouble at customs or have my meds confiscated. Since I'll be traveling alone for part of the tour, it makes me even more anxious. I just want to make sure I have everything I need, like the right documents or letters, so there aren't any issues.
Okay. Regarding this issue, we will try to provide you with an official prescription, and we'll try to see if there are any legal precautions that we need to assist you in. We will not hesitate to provide you with any supporting documents. So hopefully it will not be a problem legally wise. What other concerns do you have about your upcoming event apart from the medication?
That sorry, I think you cut off there. Could you repeat what you wanted to ask? I just want to make sure I answer properly.
I asked about your other concern apart from the legal aspect of the medications, because we will arrange that for you.
Okay, thank you. Apart from the legal stuff, I'm mainly worried about keeping my routine while traveling. The tour schedule is really intense, with different time zones and lots of late nights and early mornings. I'm scared I might forget to take my medication on time or even run out if there are delays or something unexpected happens. Also, just managing my ADHD symptoms in a new environment with so much going on makes me a bit anxious. I want to make sure I can perform my best without getting overwhelmed or burning out.
Okay, I understand that. It's important to stick to your medication, and we will try to advise you with some tips to help you stick to your routine. Thank you.
Thank you. I really appreciate your help. Having some
اوكي، هل عندك اي كومنت قبل ما نسال هنا دكتور موجود دكتور عبد الله عبد الرحمن؟
I just think I should spend more time addressing her current concern and reassure her and provide her with advice and tips on how to manage her symptoms in the new environment, and to stick to her medications, and to also to provide her with a number to call us whenever she feels overwhelmed or she doesn't know what to do.
هو الفوكس دايما بيكون على الانترفيو، مش على هنا، مش على مانجمنت. لكن اتس اوكي، لكن الفوكس يعني ما افتكر انت you did not deviate from the focus. الفوكس assessment.
ما عارفة إذا غطيت كل يعني السيمتومز بتاعت ال ADHD ولا لا. I just try to recall the important symptoms to ask about. I think I need more practice in that aspect يعني. لكن she was communicating well, and يعني it was easy to talk to her, so that was good.
هو كان في حاجه فيري تريكي ان هي كانت بتسكت شويه. ده ما دي ما مشكله بتاعت شبكه، دي كانت هي بارت اوف السيمتومز بتاعت الاي دي اتش دي اورجانيزيشن. وبعدين يعني they lose track في الثوت بروسس. فاول وحده انا افتكرتها انها شبكه، لكن بعد شويه لما عملتها كم مره عرفت ان الموضوع يعني سالتيها انت. it became it's obvious انه this is a manifestation.
Okay.
حتى الصوت بتاعها برضو كان في حتة كده بتتكلم يعني بسرعة.
بس غريب، أيوة.
فصوتها يتغير. أيوة، كان الصوت يتغير.
أنا افتكرت إن she's getting too worried or كده يعني.
دكتور عبد الله موجود؟
Yes, yeah. أفتكر هالة did very well. يعني she covered all the interview necessary for the case. Her talk about reassuring her is nice. And she went to the management of giving her a report and prescription and so forth. Although this is not part of the task of it's just an interview, لكن برضو حاجة كويسة. The lady, yes, عندها some the young lady has of the ADHD symptoms اللي هي losing track دي، وكانت واضحة من الثانية والثالثة ولحد أظن عملتها زي 5 مرات. فكانت يعني هي زعمت أنه maybe أو هالة ظنت بأنه ده من الشبكة وكده. It wasn't. otherwise كأن أنا كنت داير تتكلم لها برضو إذا كان ما قلت لها unprescribed drugs. كنت حق تقول لها السموكينج والتي الكحول والبارتيز والاذر دراجز اللي بيشيلوها الشباب دي، كان برضو لو if you talk about it يعني كان would be better. بالرغم انه هي always saying يعني هي بتقول انه at home she was cared for وما في اي problems وكده. I wanted also انه to ask who is living at home and what is the relationship between him and the others and relations in between the family members as well. And yeah, that's it. And just to pacify her that this is manageable and perhaps he might need ولما انت تكلمت في المانجمنت انه ممكن تعمل الارمز مع الصباح تاخذ الكونسيرت حقها وكده، اذا كان بتاخذه in the evening برضه تاخذه وتعمل that's I think it's good. It's really good يعني. Very good.
Thank you for the fruitful feedback, boss. شكرا.
طيب اي كومنت من اي زول؟ انا افتكر في تحسن شديد يعني ما شاء الله يعني.
لا
يعني
ما شاء الله ما شاء الله ما شاء الله. يس.
طيب السلام عليكم.
عليكم السلام حياة.
الله يديكم العافية. الله يديك العافية دكتور هان، تقديم جميل جدا. بس
Thank
أنا
you.
يعني الله يديك العافية. بس I have a question. It is يعني manageable. It is like يعني prognosis of ADHD. Can you يعني tell us about it؟ ولا وبعدك شوية لو يعني عن التريتمنت المانجمنت per se يعني ما تكونوا قصرتوا. شكرا.
انا طبعا ما اعرف لكن افتكر المانجمنت از بيوند ذا سكوب بتاع الشغل بتاع الليله. لكن اعرف يعني هو يعني اذا الدكتور عبد الله داير يعني يعلق على الموضوع ده شويه ولا لا، لكن اتس بيوند ذا
Yeah.
سكوب الشغل ده.
هاي مش beyond the احنا هي جات بكونسين معينة. She's a musician. She wants to do to perform good وما يكون عندها مشاكل while traveling. لكن برضو equally she has great concerns about أنه carrying الكونسيرت دي معاها، لأنه في many countries it has to be verified why she is taking it. She needs to have a report from her doctor, legal prescription, things like that. Otherwise احنا مشينا للمانجمنت انه دي ما كانت التاسك جوب يعني. فهي زادتها شويه وذاتس جود. خير خيرين. لكن usually to be focused يا هلا لما يسألوك من حاجة معينة انت just concentrate on that task. تمام.
Okay. Okay.
Yeah.
Inshallah. Thank you.
Dr. Yasir, also if you want to add more.
بس انا قلت لك يمكن معلق على البروجرس. الناس دي كلها ماشيه ما شاء الله، يعني كلها ببروجرس كويل. they know the task. الانكزايتي بتاعت الناس قلت شويه. الفوكس بتاع الانترفيو بقى very specific to the task. Interview skills is mainly based on
Yeah.
asking the right question وبعدين in a systematic way.
Yeah.
في حاجه افتكر في الاي دي اتش دي بس شويه انا ما اعرف انها صعبه انها تتعامل بهناي. يعني ساعات السكوت لما الزول بتاع اي دي اتش دي كوايت احنا ما شايفينه. is she quiet لانه الثought process بتاعتها مشت بعيد، ولا is she evolving into a compulsory tick؟ يعني دي طبعا ما حتبقى صعبه شويه، لكن يعني انا
Unless he's in front of you.
اي الصوت لما يتغير بتاعه شويه انا قلت is that a tick ولا في حاجه احنا ما فاهمينها بعدين. لكن يعني this is too احنا we're going deep هنا. ما I don't want to go deeper لحاجه احنا ما شايفينها. لكن
لكن أنا I think أنه she was anxious also during the interview and she wanted to put her case forward and to be understood and the doctor take care of her problems and concerns. This is why أنه في فترة كده she wanted to flare up لكن هدأت بعد ذاك وبقت عندها البوز ذلك. بالمناسبة يا هالة أنت برضه عملت about 2 or 3 poses لكن كانت يعني understood يعني.
طيب دكتور عبد الغني اي كومنت؟
شكرا ياسر، شكرا عبد الله، شكرا مهجة، شكرا دكتورة هالة. and I think we have observed 3 very successful interviews this evening. The three doctors they were very good حقيقة. وده دليل زي ما قال دكتور ياسر we are improving يعني definitely. وعشان ما يكون في gender issue أتمنى إنه الاس بي اي القادم يكون فيه 3 شباب.
أولاد.
3 شباب كده يعني ما تشرطوا عيننا يعني. فعايزينهم برضه إن شاء الله. thank you very much. They did very well. عندي 3 announcement. الاناونسمنت الأولانية يا دكتور منتصر ودكتور محمد جلال. please make sure بين الليلة وبكرة كل الترينيز الممتحنين في سنتر القاهرة وسنتر الرياض يوقعوا لنا على الإكزام تأكيد confirmation that they are attending the exam. للأسف بنرسل الحاجات وتاخذ أيام. I don't know ليه، مع إنه يكون الميشن is so simple very simple ميشن سريعة تتعمل في لحظة، لكن تاخذ أيام. أنا I failed to understand this حقيقة for the last 24 months يعني ما قدرت. فبليز يا منتصر ومحمد جلال by tomorrow يكون أي زول عايز يحضر الامتحان يأكد يوقعوا لنا. وبالنسبة ناس بورسودان يا إيمان برضو شوفي يوقعوا ناس بورسودان، لأنه في إجراءات كثيرة بتتعامل يا إخواننا it takes weeks. فبليز do this. بالإضافة يا إيمان ويوسف ناس الفاينل ام دي برضو رسلنا النموذج والقائمة بتاعتهم برضو. عندنا 29 تريني عايزينهم تكونفيرم انهم جايين كلهم، لانه برضو دي في لوجيستكس كثيره بتتعامل على حسب عدد الترينيز who are appearing in these exams يعني. فدي الاناونسمنت الثانيه. الاناونسمنت الثالثه والاخيره next week ان شاء الله حيكون في ميتنج بدل الاس بي اي، لانه next week is the last session in November. حنخش في ديسمبر، فحيكون في meeting to discuss exams, to discuss training, to discuss a lot of issues. نتمنى إنه الترينيز يرجعوا تاني للثمانينات. حسي 60 واحد ونقصوا ل 56 ورجعوا 60 ورجعوا، فحيكون في ميتنج وحيحضروا كل أعضاء مجلس تخصص الطب النفسي، لجنة الامتحانات، لجنة التدريب، المقرر، نائب الرئيس، والأعضاء برضو. وبرضو حيحضروا معانا دكتور ياسر والدكتور عبد العظيم اللي هم مشرفين على التريننج، وحنخلي ناس الاس بي اي دكتوره ساره عبد الجليل ودكتوره زينب لو عندهم الفرصه يحضروا معنا. We want to discuss a clinical training for the coming 6 months inshallah, starting January 2026 up to the end of June 2026. لو لاحظتوا الفترة الخامسة دي كلها كلينيكال، وانا اعتقد it was fruitful and beneficial. وبرضه القادمة حنعمل لها كلينيكال، لكن انا زي ما انتم عارفين وشاركتوا في السيرفيز الكويشنيرز، انا عملت 2 سيرفيز حنعرضها، وعشان نتفق على كم مرة نعمل اس بي اي، كم مرة نعمل كيس بيس ديسكشن او كيس سيناريو، كم مرة نعمل كيس برزنتيشن presented by the trainee وكيس برزنتيشن presented by the trainer ان شاء الله for the coming 6 months. دائما نحن الاوبجكتيفز بتاعتنا والجولز انه to improve ourselves, to improve our tools and forms of training. ده الهدف النهائي ان شاء الله. فده كله باذن الله في الاجتماع القادم، دور اليوم ان شاء الله الاحد القادم. شكرا جزيلا لكم جميعا.
طيب شكرا جزيلا، نلقاكم الاسبوع الجاي ان شاء الله.
شكرا ياسر، شكرا
يلا
ياسر،
في
تصبحوا
امان
على
الله،
خير.
مع السلامه.